Many patients suffering from chronic neck and back pain are now finding relief through a minimally invasive procedure, which normally has them recovering at home the same day.
There's a traditional, what we call open surgery, that all spine surgeons, whether orthopedic or neuro, know how to do. And with the modern advancements in technology, we've moved to using what we call minimally invasive, or MIS surgery, which allows the patients to really be able to get home faster and have less pain and a shorter recovery time.
With a traditional open surgery, patients receive up to a 10-inch incision. Muscles are cut and they spend 3 to 5 days in the hospital, versus a minimally invasive procedure where surgeons enter through a 1-inch incision. Muscles are gently separated and patients often go home the same day. In addition, there's a significant decrease in blood loss and risk of infection.
So the philosophies of minimally invasive surgery, or MIS surgery, is minimizing a dissection and minimizing blood loss. This turns out that the patients tend to have less pain and tend to go home a lot sooner than traditional open surgeries.
Through a 1-inch incision, Dr. Ahmadian is guided by fluoroscopy, which displays real-time X-ray images on a TV screen throughout the surgery.
In a minimally invasive surgery, we usually have a very limited field of view. We use different, what we call ports or tubes, that we dilate the muscle rather than cut it. We dilate it so we get to the area. Because we're dilating, we use a microscope to look down a tube. So a microscope is very important in minimally invasive surgery. Using fluoroscopy is very important to get to where you want to be.
Currently, the two most common minimally invasive spine surgeries are a lumbar discectomy and a lumbar fusion. For the discectomy, or disc removal, the patient is placed on their stomach. With the lumbar fusion, Dr. Ahmadian comes in from the patient's side.
Some of the most successful procedures using what we call minimally invasive technique is particularly lateral access surgery, coming in from the side. When we approach the spine from the back, this has traditionally been done for many, many years. There's a lot of muscle back there, and if you think of muscle, you should think of pain, because muscle has a lot of pain receptors in it. Going through your flank or your side, you avoid all the back muscles. You get to the spine with minimal muscle dissection, minimal muscle dilation. So patients with lateral access surgery can have fusion surgery and still go home in less than a day sometimes. It does require special training to be able to come in from the side to access your spine. And we do this surgery all the time on a weekly basis, and patients do relatively well. One of my most happiest patients are the ones that have lateral access surgery and they don't have their muscles in the back of their spine have not been messed with at all.
To see if you're a candidate for minimally invasive spine surgery, contact Dr. Amir Ahmadian at Neurosurgery of West Florida at 727-862-6524 or visit rmchealth.com.